Hey, this is a tough time for New Mexico, and we want to get right to it. Brianna, if I could have the next slide. This is the Epi report actually from yesterday. Today's just came in. Yesterday we had 1,137 cases. Today it's 1,337, so 200 more. Yesterday, 470 hospitalizations. Today, 490, so numbers continue to go up. Yesterday, 11 deaths. Today, 13. One death is too many, and we're seeing far too many deaths. You can see we're over 13.5% of the New Mexico population who's been infected with COVID. About 1 out of every 16 people who gets an infection ends up hospitalized, and about 1.7 out of 100 actually who contract COVID die. The mortality rate in hospitals is running 19%. So some grim news today. Things continue to get worse. Case counts particularly high in Bernalillo County at 385 today, Doña Ana 212, and San Juan in the highest number we've seen in a long time at 188. Next slide, please. Since all of you have been calling us and asking us, why are we seeing so many cases in New Mexico and our vaccination rate is so high, we've reorganized the press conference today to really focus on the three main things we think are driving that. Number one is Delta. As you know, it's a highly infectious variant of COVID, and it is wreaking havoc amongst unvaccinated New Mexicans. We have a little table from our vaccine report there at the bottom, and the orange bars represent the 71.5% of infections that are in unvaccinated people, the 76.9% of hospitalizations that are in unvaccinated people, and the 95.1% of deaths that have occurred in the last 4 weeks in unvaccinated people. Second is we're going to talk more today about the fact that maybe we've all gotten complacent with COVID safe practices, both as individuals, perhaps businesses, large gatherings, and we'll be going into that more. And then lastly, we'll wrap up with some of the usual reports about hospitals, but I'm going to talk a little bit about some very unique data that very few states have, but the New Mexico does, and what we're learning about waning immunity here in our state. So with that, we're going to go to Laura Perajón, who will talk about Delta and unvaccinated New Mexicans and vaccines in general. Christine on our COVID safe practices and epidemiologic trends, and then I'll wrap up as usual. So with that, I'm going to turn it over to Laura.
Thanks so much. Thanks so much, David. Yeah, very sobering today. Full vaccine is still New Mexico's first priority because that is our best way to prevent hospitalizations and deaths. Vaccines are so amazing for that. Next slide. That's why we continue to be super pleased with the vaccination rate slowly climbing. Fully vaccinated New Mexicans over 18 years old at 73%. 55% of New Mexicans 12 to 17-year-old are vaccinated. Right now, it looks like 0.0% of New Mexicans 5 to 11. It's just that the data is slowly coming in, and so we'll have more to report on that. But kids have been getting vaccinated. Partially vaccinated New Mexicans, we're at 83.2% of New Mexicans over 18 years old, 63.4% of New Mexicans 12 to 17, and then 0.5% of New Mexicans, that's our little kids 5 to 11 getting vaccinated. We have over 230,000 people 18 and over who have received a booster dose. So that's really good news for New Mexico. Next slide. And thanks to all of you who are going out there and getting vaccinated. We are having great progress, but there's still many New Mexicans who remain unvaccinated. And in this context, what David is sharing is that within this context, we only actually, if you look at all of New Mexico, 60.4% of all New Mexicans are vaccinated, but that also means 39.6% are unvaccinated. So the progress is good, but there's still groups of people who are getting sick with COVID and spreading the virus amongst the whole state. And then partially vaccinated, we're still at 30.5% unvaccinated. So, I think that when we look at the whole picture of New Mexico, knowing that there are people who are unvaccinated is still driving high case rate despite the vaccination. So things to really look at and really think about how we can reach out to people, talk to our trusted people who are trusted in our community, and get our questions answered about the vaccine. Next slide. So being able to make a vaccine appointment, we're trying to make it easier and easier to get a vaccine. You can still get appointments at vaccinenewmexico.org. We have thousands and thousands of appointments available. You can also schedule an appointment with your primary care provider if they have them, or a pharmacy. Remember, you can get your flu shot at the same time. And once again, just talk to people, your providers, other people you trust if you have questions about the COVID-19 vaccine or about your eligibility for a booster dose, which is actually most of the people in New Mexico are eligible right now for a booster dose. Next slide. Also, for those of you, once again, we just want to call out, as always, and thank our call center here in New Mexico for people without access to a website. The call center really wants to support all of you out there without internet or ability to schedule online. Option 3 or 9 takes our callers directly to Spanish speakers, and 8 to 8 p.m. is when we have our site open, and it's open Monday through Sunday. So let's go to booster dose administration in New Mexico. This is really important, especially David will talk more about some of the immunity issues right now, but if you see the next slide, you can see that we started with the Pfizer and Moderna additional doses for people who are immunocompromised. And then after in September, the Pfizer booster dose was approved. And then in October, all 3 vaccines are approved for boosters, meaning now you can mix and match. You can get if you have a Pfizer, you can get a booster dose of a Moderna or J&J. So we've had over 220,000 doses administered so far. And so that's really, really good news, because the booster will help for waning immunity. Next slide. One of the things that is really, really worrisome to us, and we are very, very worried and concerned right now, is that if you see on the slide to the right, you can see the green line is our 65 and overs. And so for people who are 65 and over, initially, when we didn't have vaccine, you could see high case rates, but then they started coming down after so many of our 65-year-olds and over got the vaccine. But as you can see, our case rate for 65 and overs are increasing. And actually, in fact, all groups are increasing in age groups, but the 65 and overs are the most vulnerable. So we really, really ask, if you are 65 and over, please sign up for a booster dose today at vaccinenewmexico.org, or call for scheduling an appointment if you have difficulty. On our website, you can also see that you can get Lyft or Uber if you have trouble with transportation. So we really think that's one of the things that can really make a difference right now. Next slide. One of the things is that we are texting people to, remind them if they are eligible to get their booster. But if you have already gotten your booster and you got it at a pharmacy and you had originally registered in our registration app, you can actually go into the registration app so you don't continue getting text messages. So you can edit your vaccine history at vaccinenewmexico.org. And if you click vaccine history, you can update and that'll say, you know, you got the 3 vaccines, and then we won't text you anymore. So this is just a little tip for those of you who are getting messages and you've already gotten your boosters. Next slide. Here's an update for the vaccines for 5 to 11-year-olds. So we are excited about vaccinated 5 to 11-year-olds because they are the next biggest unvaccinated group we have, and children can get very sick from COVID. COVID in children is generally milder than adults, but some kids can still get really sick and require hospitalization. Delta in the whole country has resulted in a 5 times increase in child COVID-19 hospitalizations, and the virus can actually cause death or long-term complications. And yes, there are David's reminded me, there are 188,866 kids in New Mexico who can get vaccinated. And I know some of them already did, so we're excited about that. Next slide. The vaccines have been shown and proven to really help prevent the spread of the virus. Children can spread like COVID-19 if they do get infected. And oftentimes they're asymptomatic, meaning they don't have any symptoms. So they could be spreading it and you don't even know that. So getting vaccinated can really help protect your loved ones and your community. So when kids get it, they don't spread it to people who are maybe immune compromised and didn't mount a good response, or maybe they're unvaccinated. It can help prevent variants from developing and mutating because the virus does go to people who don't have, who haven't had COVID yet and mutate. So, and vaccines just allow kids to be kids again, just having them return to their normal activities and not having to worry about getting COVID. Next slide. The COVID-19 vaccine for kids is safe and effective. Once again, the safety trials showed that it was 91% effective and super safe for kids. It's 1/3 of the adult dose. And remember, it's 2 doses 3 weeks apart to become fully protected. So 1 dose isn't enough. Some people are getting just 1 dose, but really you need 2 doses to have the effect of preventing hospitalizations and deaths. The mild side effects of the dose is because it's lower, and they kind of seem to have less effects than the older children. Once again, just a reminder that the vaccine is free to every single person, doesn't require insurance, doesn't require identification. So please go and get the vaccine for your kids and for yourself if you haven't gotten it yet. Next slide. We're adding more appointments every day for 5 to 11-year-olds. As of the 9th, 42% of our appointments for 5 to 11-year-olds were filled, and vaccines continue to be delivered to New Mexico, and more appointments are added each day. So we really continue to appreciate your patience as doses arrive, but we are getting more doses every day. So, and there's plenty of slots still available. Next slide. One thing is we've gotten a lot of questions about the pediatric Pfizer and birthdays. So let's say your child is going to turn 12 years old between their 1st and 2nd dose. They can either do the pediatric Pfizer, which is an orange top, or the adult Pfizer, which is a purple top. So those of you who have kids 5 to 11, just always remember it's the orange top. If you can always ask them, like, did I get the orange top? And if you're turning 12, you can get either one. And that's like 3 weeks. So like, let's say you're turning 12 in 3 weeks, you can choose either one, or you're just turned 12. So just a little reminder for those who are turning 12 out there. One thing that we're also wanting to share is addressing health misinformation. One of the things we've seen in the COVID pandemic is so much information, and how do you know what information is helpful and what information is harmful? So recently, the Surgeon General put out a community toolkit for addressing health misinformation. And the link is on here in case people want to get it afterwards. Next slide. And it's a cute little health misinformation guide that actually is really easy to read. and just shares about information, misinformation being information that is false, inaccurate, or misleading that can cause serious harm. And we know that during the pandemic, there have been a lot of cases of misinformation causing certain people to maybe not want to get vaccinated. So getting that information could be so helpful. So the toolkit really helps the community understand, identify, and help stop misinformation, and help identify information that actually can improve our health. And it gives great tips for talking with family and friends and community about misinformation, like really listening, empathizing, pointing to credible sources, never publicly shaming anybody or shaming anybody for that matter, being judgy, and using inclusive language. So we hope these tools can actually help us to continue to share the message of keeping our community safe. Okay, and now I want to turn it over to Dr. Christine Ross. So thank you, Christine.
Sure. Thank you so much, Laura. And thanks for the opportunity to let me have this chance to speak with you all. So I'm going to start just quickly mentioning what's happening globally. And I think we can sum it up by one statement. The pandemic is far from over. Globally, we're seeing a rise in case rates, and this is primarily driven by Eastern Europe. There are countries such as Russia, which are seeing higher case rates now than they had seen in a very, very long time. And what's unfortunate in certain countries where vaccination coverage is really low, again, I will mention a country like Russia, where the latest numbers I knew, there was about 1 in 3 Russians vaccinated. The death rates are also quite elevated. Case rates are driven by Europe in general, so most activity is in Eastern Europe, but we're also seeing countries in Western Europe with surging case rates right now, places with really high vaccination coverage. This is certainly a complicated issue, but we know it looks like these surges are primarily driven by Delta. And I think the difference here is that we're seeing lower hospitalizations and lower deaths when you compare to countries that are seeing surges that have much lower vaccination coverage. Now, the United States as a whole, we saw quite a surge of cases related to Delta, which began in about July. And most folks in the United States are now getting or some counties anyway, are getting a bit of a reprieve now. And we were seeing a decline in this peak of cases that we were seeing from Delta. It looks like that downward trajectory is slowing, and we might see the United States reach a bit of a plateau. So that's something that we're going to keep an eye on. But why this is slowing and why we're seeing a plateau, this is because we're seeing rising incidents in some areas of the United States, including New Mexico. And so I think we'll go to the next slide. Okay, so this is our statewide Epi Curve. And one thing I want to mention is New Mexico is not alone. There are other states seeing a rise in incidence or case rates. I believe the entire Four Corners right now. I think parts of California, the Northwest are still seeing some pretty high case rates. So we're certainly not alone. And when you look at the level of community transmission across the United States, 80% of counties in the United States are still seeing high levels or substantial levels of community transmission. So here in New Mexico, we know we also began to see a surge related to the highly infectious variant of Delta. And we sort of hit a peak there. You see that on the right hand of the slide. We started to trend downward, but then we hit a plateau, and now we are seeing rising incidents or a rise in our case rate. So this is very, very concerning. This is certainly not the direction we want to go in. And I don't think I have these slides, so I'm just going to mention them briefly. We're seeing very high case rates across the state. So this is from the Northwest to the Southwest to the metro region. These are high levels of case rates. And I believe I'll be able to show you later our level of community transmission map, where you'll see every single county is sitting in, except for perhaps one or two, are sitting in the red. So let's go ahead and go to the next slide. So this is just a blow up of that statewide Epi Curve, where we plot the number of cases each day and sort of trend. We're able to see the trends over time by using these Epi Curves. So this is just a blow up of the recent 6-week activity. And why we do that is so you can really zone in on that 7-day moving average, which is that dotted black line. And you can see that it had plateaued and now it's slowly rising. Okay, next slide. And this is another really important metric that we keep a very close eye on, and this is the test positivity. And we've rolled this into what we call a 7-day rolling average, and this is plotted over time, and you can see that we had a very high test positivity, or in other words, out of everyone that comes out and gets a test, how many are positive, and then we look at that as a percentage. And you can see that we were quite high in the winter. We trended down in the spring and then the summer. And then again, when Delta became the predominant variant in New Mexico, we began to see rising incidence or case rate. And then we began to see this climb in our test percent positivity, which is now up to 11.8%. So very high. And so what this tells us is that we do need to see more folks get tested. We also, it just tells us that we have a lot of burden of disease right now in our communities. So next slide. And so this is what I mentioned briefly. This is a table and a map that we produce using our COVID-19 surveillance data, and we calculate a case rate and a test percent positivity for each county. And then there is a table which shows you what our cutoff is to call something high versus substantial, all the way down to low. And you can see we're unfortunately in a sea of red, and I see one county now that is in orange, which we still consider substantial level of community transmission. And you can see we've put the highest, so the county with the highest case rate at the top, and then you go down from there. And so you can see right now we have very high case rates in Debaca, Grant, San Juan, Lincoln, Colfax, and then just on down the line. And again, I want to emphasize, even across the United States, if you look at this at the county level in the United States, about 80% of counties are considered in the high level or the substantial level. So even though some places are now seeing a reprieve with a decrease in case rates, we still have a lot of activity here of this Delta variant in the United States. So next slide. And I think there was a question on this last week, which went to Secretary Scrace, and I think he did a really good job at answering it. So I'm not going to go into a lot of details, but this just explains how do we calculate a case rate, which is really a basic measure of the frequency of a disease, and it takes into consideration the number of cases and population size. And then we calculate this out per 100,000 of population so that you can easily compare large and smaller counties and have an idea of the level of activity in that county. So I think at this time I'm going to turn over to Secretary Scrace, who is going to do the remainder of the slides.
Thanks, Christine. The next one is a bunch of layers of Swiss cheese. You sure you don't want to do this one, Christine?
Okay, I'm sorry. Maybe I got the order wrong. So I think the point of this slide is to just say, we haven't, I think there's been a lot of emphasis on the hope that we could obtain herd immunity, and that has not been demonstrated in any country to date, even with much higher vaccine coverage than we have here in the United States. And so we really want to emphasize it's really, really important to protect yourself, whether you are vaccinated or not. With this high level of disease activity in our community, we really need to layer our prevention measures. So I think the Swiss cheese is a really cute pictorial there, but it's basically trying to emphasize that you want to layer things on top of each other to get the full protection. So certainly vaccination, we think, is our way out of this pandemic and is the #1 way to protect yourself. But that alone is not going to give you the highest degree of protection. There are things you can add on to that, and that includes wearing a mask when you're indoors, trying to avoid crowds and poorly ventilated places, physical distancing, etc. So I think the take-home message is that we just wanted to re-emphasize that although vaccines are the most powerful tool we have right now and highly effective at preventing serious illness, including hospitalization and death, with this high level of disease activity in our communities, we want you to really consider adding on these additional layers of protection for yourself and your family. If we all together really focus on these COVID-safe practices, we think we can turn this trend around and in the right direction. So let me see. David, I think the next slide might be yours.
Yep, I think it is. Thanks. So before I get into vaccine breakthrough cases, I want to point out that you all today are going to see some data that very few people in the United States are seeing. And it's because of the ability of our epidemiologists and the system they've created to track every patient, to link them to each vaccine, and to measure time intervals. We're excited about this, although in some ways, it's good that we know it. In other ways, there's a little bit of bad news here, but I think the follow-up good news is there are interventions we can do to address this issue. So if we go to the next slide, you're gonna really like, well, actually, let me do this slide first. Just a review, we showed this at the beginning. Orange here is the number of cases, hospitalizations, and deaths in people in New Mexico who have not been vaccinated. Very sobering that 95% of the deaths are in unvaccinated people. And blue are the number of cases, hospitalizations, and deaths in New Mexico in vaccinated individuals. And in fact, you can see we've had 7,479 cases in vaccinated individuals just in the past 4 weeks, less hospitalizations, and we believe the vaccine still is effective, even though vaccinated patients are getting cases, because it largely and fairly dramatically prevents hospitalizations and even more dramatically deaths. Remember that there are twice as many New Mexicans at risk here in the blue group, because we're 2/3 of us are immunized, or if you take all New Mexicans, 60%, but you can see that how that breaks out. So let's talk about the blue for a minute and go to the next slide. This is our epidemiologic data. This is a little complicated, so I want to walk it through. So on the x-axis, if you look there, you can see that we've got the specimen collection date, and that's the date at which someone may have become, had a positive test. We go by the date that their specimen was turned in, not when the result comes back. And so you can see, we go all the way back to January 14th, all the way through to the present. And each blue dot on this graph is a vaccinated New Mexican who has tested positive for COVID. So each blue dot on this whole graph. Now on the y-axis, we have the number of days it was between when somebody got their final dose of their vaccine and when they tested positive. And so that's the y-axis. And there's a diagonal line that sort of, this is a triangle because of course you can't, if it's been 2 months since you're back, it's a triangle because first you get vaccinated and then you have the positive test. So only the amount, you can't have a case before you get vaccinated, otherwise you would not be a blue dot on this graph. Now, if you squint a little bit and sit back, you'll notice that there's this dark blue trapezoid in the upper right-hand corner. It's kind of spotty if you watch across here from January to late June, and then all of a sudden, and Brianna, we practiced this, we'll show you a line, a vertical line, where there's this new frontier where spotty dots turn into solid dots. And Brianna, we can't see, there we go. Okay, so no, it's that one, no, let's do the vertical one first. So what happened there? If you go down to the x-axis, you'll see that's right about mid-July when the Delta variant took over. So going from left to right, you can see, wow, something really happened. It was very different in July, and we all know the new variant came in. It's now 100% of all of our cases. It's twice as infectious as it was before. On the other hand, if you go from the bottom up, you'll notice a diagonal line that seems to be much more prominent in, let's just say late July all the way through the present. And what that shows is as people's the number of days between when they got their last shot and their case goes up, more and more people seem to be infected. Now, still, if we had a similar map of unvaccinated people, it would just be a giant solid blue triangle. So we still have some individual dots here, but you can see that something else is going on. So left to right, the Delta variant hits us in early mid-July. Bottom to top, there's this waning, there's this increased number of cases. And if you look in the lower right-hand corner, and I have a bigger version so I can read this on my other screen, the average amount of time for a vaccine breakthrough case in New Mexico is 163.4 days, which works out to about 5.5 months. The median, if we have statisticians watching, and I know we do because I always get commentary from the statisticians after each press conference, correcting statistics sometimes, but just adding additional perspective. The median is 170, very close, 5.6 months. So what we're learning is people start becoming more likely to get a vaccine breakthrough infection at about 5.5 months. Now, it turns out that if you are vaccinated, at least up to this point, your chances of having a breakthrough infection are very low. They range between 1.5% and 2.5%. So out of 1,000 people somewhere who are vaccinated, only 15 to 25 will get a breakthrough infection, relatively small number. But what we're learning is that immunity does wane. We're seeing it in our data. And what this means for us is we all need to start getting in line to get a booster. We're working with the CDC on their guidelines. They can be confusing. For sure, you need to be 18 and over. For sure, you have to have at least 2 months since your J&J vaccine under your belt, or 6 months for Pfizer and Moderna. If you were watching really closely, Laura showed a slide that showed our peak vaccination rate, which was in the 140,000 per week range, occurred in April. Well, here we are 6 months later, a little bit more in October, November. So it makes sense that we're now seeing more of those vaccine breakthrough cases. The antidote to that, of course, is getting the booster shot. So a strong pitch today for getting the booster shot. You can go online, the DOH website, and get signed up. You can reference the criteria through a link on the DOH website, but you can also just plain make an appointment for that booster shot encouraging all New Mexicans, and particularly, as Laura said, those 65 and older to get first in line, and then all of the rest of us after that. Next slide. So again, just my hats off to our epidemiology folks for having this data and enabling us to analyze it and reach these conclusions. This is kind of a similar graph from Israel. I had a couple very complicated New England Journal of Medicine slides, and my colleagues convinced me that they were not that easily explainable. But you can see in Israel for the period of the vaccine, and they started just like us in December, this sharp uptick in July that happened, and again, right about 6 months. So, note, please make a note, please make an appointment. And, Christine and I talk about this all the time, but I think Christine's version I really like is this is a 3-shot series, if it's Moderna or Pfizer. Those of us in healthcare get a hepatitis B vaccine. Yeah, we get it in month 1, the first month, the second month, and then 6 months after that. Very similar to this. So for me, when I got my booster last month, I considered it my 3rd shot in my primary series. Time will tell if we need other boosters going forward. We just have no way of knowing that now. Okay, let's move on and update you all on hospitalizations and deaths. Again, not very good news with hospitalizations. Next slide, please. You can see we continue to be quite red in most areas. You can see our graph continues to journey up into the crisis standards of care on the right there. Now, last week, San Juan Regional Medical Center did declare crisis standards of care. And while no other hospitals have declared that, I'm in conversations with multiple systems in New Mexico who are considering that today. So our hospital teams are really stretched thin, and they are seeing way more patients than they thought possible. ICU occupancy rates are over 120%, and we are struggling to try to make ends meet. I want to make sure that people understand what this means. And I don't know how many people are watching this press conference, but what it means is if one of the people watching this press conference has a heart attack right now, there's a good chance that we won't have an intensive care unit bed for that person here in New Mexico. So this connection between the COVID safe practices and keeping ourselves safe and getting vaccinated and getting boosters and all those things, there were those different slices of Swiss cheese, connects directly to our hospital personnel and what they are really up against right now and handling this overwhelming load of patients. Next slide. I've been presenting these maps for a while. You're probably all yawning a little bit about them. Today it's in the fine print. We don't have the big red numbers, but we only have 8 ICU beds in the state. That was yesterday at 3. Those all filled up pretty quickly last night. Maybe there's a few discharges today. We have not been in single digits. Colorado is over 1,000 ICU beds, was panicking when they only had 100 ICU beds open. And so this is a really serious time. Again, general medical surgical beds for COVID patients, hard to read, but I think it's 51 open beds. That's open beds are trending downward, full beds trending upwards. So, and a lot of transfers with respect to, now let's go to the next slide. And then to make matters worse, our hospitalization projections from Presbyterian, which are the shaded area, shaded colors there. Blue is all hospital admissions projected to continue to go up for the next 2 weeks. Hospital ICU bed capacity, it's just on a teeny bit, but the fact is we're full, so it can't go upwards. We can't have any more ICU bed hospitalizations because the system is full. Next slide, please. In order to try to deal with this, we're doing a lot of work with the federal government, and we also, the state has acquired or executed a contract with an outside staffing agency. And you can see we are sending staff to some of the largest areas of need here in the state, 281 new folks coming in. This is reimbursed by FEMA. And San Juan Regional Medical Center, where we're having large numbers of people that they can't take care of. So transferring to other parts of the state, including even Las Cruces. They have a DMAT team that's included in their numbers, about 40 people that the feds are providing, healthcare workers, nurses primarily, and other technicians and pharmacists to help them through the surge they're experiencing. It is very, very high in the Northwest. Again, to point out that the Northwest was one of the first and leaders, particularly due to IHS, to get their population vaccinated. And again, with the Northwest, we're now 6 months out from when the majority of people receive their primary and secondary doses of the vaccine or their one J&J shot. Just a reminder, because I keep talking about 6 months, that booster for J&J is at 2 months. So every time I say 6 months later, I'm referring to Pfizer, Moderna, which are the two messenger RNA vaccines. New slide, please. Deaths, again, we seem to be on this plateau. That's good. If you're not one of the people in one of those blue bars, still seeing as many coming in, 7, 8, as today, 13, and we will probably backfill some of these numbers, but we believe we are at a plateau. The best plateau for deaths, of course, would be 0. Having 45 to 50 a week, not a good place to be. And again, for every single person who passes from coronavirus, there's 10 to 20 New Mexicans who are friends and family of those individuals. So a much broader impact in our state. Next slide, please, Brianna. We're going to talk about treatments. Some good news there. You know, in our modeling team yesterday, you can go to the next slide. We talked about the fact that the monoclonal antibody treatments had a dramatic effect on reducing hospitalizations. You might be thinking, well, why is it so great if our hospitals are completely full? And what the modelers are saying is we would have had a lot more patients were it not for getting more people treated with monoclonal antibodies. Remdesivir continues to get up to record numbers of treatment. That's the inpatient antiviral medicine for moderately ill people who've already been admitted. But more importantly, the monoclonal antibodies are for anybody with a positive COVID test, symptoms, who either is 65 or older, or is obese, or has any risk factor for coronavirus. And so again, if you get a positive test, your next step should be to seek out immediately with your provider if you're having symptoms and you meet one of these other criteria, being older, being obese, or having one of those underlying conditions. Please call your provider right away and get scheduled for treatment. There's a third monoclonal antibody out. We're setting up the reporting system for that. Limited use so far, but we'll be adding that to our numbers in the very near future. Okay, let's move on. I think we're almost to the finish line. Oh yeah, we've got some, I want to shout out to Guadalupe Hospital, very tiny hospital in Santa Rosa. Christine, if you're listening, fantastic job ramping up on monoclonal antibody treatment. GIMC, who's in our top 5 pretty much every week, Gerald Champion. And you'll notice that some of these places with the high monoclonal antibodies are also in the same locations that the state is sending staffing resources to try to help out for the same reason, that those treatments to avoid hospitalizations are being done in higher numbers because hospitals are getting full. Also, Carlsbad Medical Center, thank you for your participation in Memorial down in Las Cruces. Again, everyone is ramping up their antibody administration. It's the singular thing other than vaccination that can turn the tide against our uptick here in a short period of time. All of those COVID safe practices can turn the tide in the long run. Next slide, please. So let me just sum it all up. We told you that, the reporters, you're all asking us questions. Why, if with New Mexico, such a great vaccination rate, why are we seeing this persistent uptick in cases when neighboring states are not? So just remember that any rise in the number of cases, no matter what the reason, puts more pressure on our hospitals. Those are already full and they're coming up on flu season and this surge of COVID patients. So as Christine said, this pandemic is not over. Anyone who's not vaccinated please get vaccinated. If you haven't had your booster, please go online and schedule one. And we need to understand that we're entering in a phase where we're going to have to pay even more attention to COVID and trying to stop the spread as we are now. So calling on all of you to help us. Final slide is similar to the usual final slide. We're not done with this. Get tested, please get tested. We don't have enough testing going on today. It was 11.8 in Christine's graph. Over the past 7 days, it's 11.9% today. So get tested if you have any concerns, symptoms, or exposures. If you have a positive test, get treatment to avoid hospitalization. And please be careful, masking, distancing, particularly indoors. There is a public health order. It does have the force of law to it. We're seeing a lot of places around the state where people simply abandon the use of indoor masks. And as you do go into an indoor setting that's not your home without a mask, or you see other people without a mask, I want you to remember that being inside without a mask is a primary reason why, if one of us has a heart attack today who's listening to this presentation, there probably won't be an ICU bed for you. So with that, I don't mean to be grim today, but the situation is tough. I'm going to turn it back to you, Matt, to lead our question and answer session. Thank you.
Thank you so much, Dr. Scrace. And with that, our normal format, please go ahead and raise your hand if you'd like to ask a question. I see that a couple of folks have dropped questions in the chat, so that I'll just read those out when the time comes. And just a reminder, if you can, just do one question at a time, and we'll cycle through the list as many times as necessary in order to make sure that everybody gets to ask their questions. So with that, we will start with Dan Boyd, followed by Michael McDevitt, and then Julia Goldberg. And when I call on you, please just say the name of your outlet as well, if you don't mind. Thanks so much. Dan, you are unmuted.
Yeah, good afternoon. Good to see you all virtually, like always. Wanted to ask, I think Dr. Scrace, you talked a little bit about maybe compliance with COVID safe practices being an issue amid this recent surge in cases. Obviously, the state's current public health orders is set to expire Friday. Wanted to see if you had any insights as to whether there may be some changes or revisions to that, given where we're at and kind of the direction things are going.
Yeah, that's a great question. I think if you remember, I said once the case rate gets down below 10 per 100,000, and we'll take another look at that. I think we're at 66 today, so more than 6 times the level. We do plan to renew the indoor masking in the public health order. We're making some minor revisions to reporting requirements for hospitals, nursing homes, and assisted living facilities. They've been reporting weekly. We've gotten great data from them. We didn't share it with you today. You've seen it every week. We'll probably have them report to us monthly going forward, and then we will share that information with you for sure. As of this week, looking across the country to see other interventions that other states are doing, but New Mexico seems to be in the lead. And the one thing I would just remind you, I know we've talked about this before, Dan, is I think one of the most important criteria for a public health intervention is it has to be something that we can really live with going forward. This battle against COVID, it's not a roller coaster that's going to go up and down one more time, and then we're going to be fine. We're going to see as the virus mutates and creates new variants, additional challenges. And so, as I've said before, I think indoor masking, while not everybody likes it, is something that if everyone did it would make a big difference. I think return to school, is an example of something we have to do because we can't really live with the pandemic with kids just going to school, from home. The learning is not as good. And so we're carefully weighing those, but there isn't anything else on the docket. And even that thing I said about reporting for healthcare facilities, we're not, that probably won't even be in the public health order. We're just advising facilities who are reporting now that they can report on a monthly basis. So sorry, I don't have anything more additional to add. I'm so looking forward to answering this question again when our case counts are down below 10 per 100,000. And I think we probably will have things to talk about then. But, we're on the way up, and this is not the time to relax our current public health orders. One last thing too is that because of the way that federal revenue comes to New Mexico during the national public health emergency, to the extent, let me think another way to say it. As long as there's a public health emergency at the national level, there will be some form of public health order in New Mexico of a state of an emergency. So those two go hand in hand. And so, but what's in the public health order is really what you're getting at. And that may vary as we hopefully see more adherence to COVID safe practices and more people getting vaccinated and everyone getting a booster and a resultant decline in the case counts. Thanks, Dan. Anything else to add?
Yeah, I may have another question later, but I'll wait till everyone has a chance to.
Okay, thanks, Dan.
Okay, next we'll turn to Michael McDevitt, followed by Julia Goldberg, followed by Juno Ogle. Michael, you are unmuted. I see that Michael lowered his hand, so he may not wish to ask a question any longer. Julia, go ahead.
Thanks, Matt. This is Julia Goldberg with the Santa Fe Reporter. Thanks for taking the first of a couple of questions. I've had a lot from readers this week, but this is my question. I was wondering if you could tease out for me a little bit. Dr. Schrace, you showed the percentage in the past 4 weeks of cases among the vaccinated versus unvaccinated. The differential between the cumulative and the past 4 weeks at 80.4% for cases versus 71.6%. Is there a proportionality with the increased number of people vaccinated? What piece of that is sort of waning immunity versus deterioration of infection control? And I guess the end game of my question is, how do you think that would change if boosters got to what percentage or what level? Does that make sense?
Yeah, no, it does. I think the fundamental core of your question probably is impossible to answer, but Christine and I will still have stuff to say about it. So the first thing I would say is the one thing you left out is Delta and the emergence of that variant. I think that's what's driving actually a prominent factor in driving infections in both infections in both unvaccinated and vaccinated people. Second, in terms of waning immunity, we still have to sort that out, but obviously that whole pandemic period of time includes, let's just say for me, I'd be I'm not on the vaccine breakthrough list, but I had just gotten my shots in January, and so that my lack of infection in January, February, March, April, May, June is sort of included in that overall group, and so I'm one of those people in the, what would it be, 98 or 97.5 to 98.5% of vaccinated people who have not gotten a COVID infection. But there's no question that hospitalization rates are going up in vaccinated people individual. And on that the vaccination report, after the little blue and turquoise bars, there's some graphs that show a profound uptick in unvaccinated people in terms of cases, and a gentle uptick, which is what you're asking about in vaccinated individuals. I don't know, Christine, what else would you say to shed light on this proportionality question?
Well, I think if I'm understanding correctly, I think the question was what's happening between the cumulative and then the most recent 4 week. And I think I'm not able to pull the report up at the moment, but
I can.
Okay, and if you look at that, you can track it over time, and I think what I don't have anything new to say, but just to add what you just said is that I think by surveillance data and also data from various sources, we do know that about 6 months to 8 months out from that second shot of mRNA vaccine type, you do have a decrease in vaccine effectiveness against prevention of infection. And that's why we are where we are with the booster recommendations. And so I think, again, we're accumulating evidence as we go along because we're in the middle of a pandemic. So it doesn't mean that the vaccines are not an incredibly powerful tool. They are, but I think what we have found out is that we're gonna need this shot at about 6 months out, 8 months out, and that's why we're really imploring people to get out and get that booster shot. But you slowly over time are seeing that proportion of individuals that are vaccinated turn up positive. But I think it's really important to mention, though, even though we're seeing this rise in incidence or cases among over time among people that are vaccinated, many of these infections are quite mild. Many of them do not result in hospitalization, and certainly do not result in death. So it's just really important to emphasize that these vaccines remain highly effective at preventing these serious outcomes. And then I think, David, you also alluded to, certainly, you know, our risk-taking behavior is changing over time because we're so far into this. And, you know, what we were willing to do initially with, you know, sheltering in place and avoiding gatherings and crowds, it's very hard for all of us to continue with that same level of restriction on our lives. So there's certainly more opportunities for the virus to transmit. Folks are getting together, they're gathering, they're traveling, etc. And then when you put that together with Delta, it's just a perfect storm.
Yeah, and I would add one more thing, Julia. The epidemiologist, that little blue dot graph I showed you is part of a new report on vaccine breakthrough that we are vetting with the modeling team this week and hope to put online next week, because we didn't think there were enough reports that you could ask us questions about, and we wanted to add just one more.
You know, I requested that report this morning.
Yeah, okay, good.
Great. So I'm going to actually turn back to Michael McDevitt, realize that he did, in fact, want to ask a question. So, Michael, you are unmuted.
Hi, all. This is Michael McDevitt from the Las Cruces Sun News. Thank you for speaking this afternoon. Going back to Dan's question about the mask order and your intent to renew it, do you believe the state is doing enough to enforce the mask mandate at this stage in the pandemic? I know from personal experience down here in Las Cruces, I see quite a few businesses that have completely decided not to enforce it among their own staff and customers, and it almost seems like every other business I walk into is not enforcing it. And I know from our own police and sheriff's office here that they haven't done a lot of enforcement. So is that something that needs to happen, especially as our area seems to be highly ranked in test positivity?
Yeah, Michael, we had a little trouble with your audio, but I think I got the gist of your question. And it was, is the state doing enough to enforce mask orders? I think there are two additional questions. One, are individuals themselves doing enough to enforce the mask orders by wearing their masks? And the answer to that's probably no. We don't encourage individual A to try to enforce the mask order on individual B, because that can result in confrontation, injury, and death, as has been seen in other states. On the other hand, and then the next question is, are communities doing enough to enforce the mask order? And so I don't know the answer. It sounds like in your community, perhaps there's room for improvement. The state simply can't enforce every single mask, infraction. There are reporting online Our environment department does actually through OSHA get involved in workplace violations. You know, sometimes, I mean, I actually get text messages of a picture of someone on the Santa Fe Plaza without a mask, and like, that's it. So that's not really actionable information unless I happen to be on the Santa Fe Plaza. And probably I would actually be willing to go up and flash my DOH badge and say something. I'm known for that in the community. So I think it's a balance between individual responsibility, community responsibility, and state responsibility. We can't be everywhere at every time. We try to respond to complaints, and we'll continue to do that. And I also think that this is going to really involve a cultural change in how we think about wearing masks and protection. I know other states, interestingly, New York, I know is a state, San Francisco is a city. You know, if you have to show your vaccine passport to get into a restaurant or to get into a concert or do things like that. So, you know, we're looking at everything everybody's doing. I think the trouble is there's limited data on the absolute effectiveness of vaccine passports, for example. We got a ton of evidence on masks. So I think we all ought to pitch in and do a little bit more to step up at the individual community level. And at the state level, I'm committed to actually ensuring we enforce it. We're sending out a letter today to an organization that did not enforce a large gathering event, and most people were not wearing masks, and that is a $5,000 fine. So it is our intention to continue to try to do everything we can to one, convince people it's a good thing to do, and enforce where that becomes ineffective. Long answer, but it's kind of a complicated question. And obviously the fact that people's political beliefs bleed over into whether or not they wear a mask or whether or not they get vaccinated, not everybody, but some people, that makes it even more complicated as well.
Okay. Next, we'll turn to Juno Ogle, followed by Scott Weiland and then Brittany Costello. Juno, you are unmuted.
Hi, yes, Juno Ogle with the Roswell Daily Record. Thanks again for allowing us this opportunity for questions. My question is about the Test to Stay program that Secretary Steinhaus talked about last week, but I hope it's one that you guys can address. The Roswell School District, one of their concerns with the program, they're very eager to do it, but one of their concerns is about the supply of the rapid testing kits that they'll be using. They've already encountered some issues with not being able to get as many tests as they have ordered. Their supplier said, this is all we can send you. And they're just concerned that with the potential number of students that they may have to test in this program, they won't be able to keep enough on hand to meet the requirements, as well as doing the surveillance testing for staff at the same time. Are you hearing this concern from other school districts, and what can be done? What can the state government or even the federal government do to maybe help out with that supply issue?
Yeah, I think, you know, in Alamogordo, the very first day we did this, we thought, wow, this is going to be a bigger project than we thought because we had so many positive cases. The availability of rapid testing has been the subject of a lot of White House and governors meetings, and obviously the program only works if we have the testing materials. We have a very diverse testing system in New Mexico, one of the most robust in the country. And so I think that, you know, we have a capacity to do additional PCRs. We can do an additional, with existing capacity, probably 8,000 tests a day in the state. So I'm going to say that much. Our Chief Medical Officer, Tom Massaro, is working with public education to get this program up and running. We still have that pilot in Alamogordo, looking to spread it soon. And Laura, any additional comments?
Yeah, I mean,
supply?
Yeah, we've been working a lot with the different providers on trying to get more rapid antigen testing, which is kind of the basis for the for the test to stay because you can test them really rapidly, get the results, pull the kids out. So we are working on that supply chain right now. So I feel pretty confident that we'll have enough supply chain. It's true that the rapid antigen test has been a little bit, there has been some delays in getting them out, but the other states that have been able to do this have not had a huge supply chain issue. So I think we'll be okay.
And we can still use PCR. It's not as real time, but it is a little bit more accurate. And so, our test turnaround time is now down to like 30 hours on average statewide, best it's ever been. So if we need to use that as a backup, we can. Thanks.
All right, next we'll turn to Scott Weiland, followed by Brittany Costello, followed by Morgan Lee. And Morgan, I know you dropped some questions in the chat. I'm guessing you're going to ask them out loud, but if you need any assistance with the ones in the chat, just let me know. Scott, you are unmuted.
Yes, Scott Weiland, reporter with Santa Fe New Mexican. And yeah, thanks for taking our questions. Yeah, you've said that you've referred to, yeah, we've all got pandemic fatigue, but then, you know, and then you say, get out, get your boosters as soon as you can, but it's still limited. So most of us still aren't eligible. So I guess considering that, and then winter's coming up and the holidays, kind of at what point to, you know, do cases have to rise before you might consider bringing back some kind of additional restrictions, like, you know, maybe reconsider the tier system we were on for a while, because it does seem like it's still varying somewhat county to county. So one county, you know, go back to one county being restricted more depending on their spread and that sort of thing, or is it just off the table? This is just something we're not going to go back to because we're all burned out on restrictions.
Well, I mean, I think that's a great question. And I think that I think what we're trying to do is not avoid public health directives because we're burned out. We're trying to find that middle path that allows people to live relatively normal lives, that restores the economy, that allows kids to get education, and at the same time minimizes the risk. I think with Delta, a virus that's 2 to 4 times as infectious, I think none of us here would probably be willing to prove that we were being 2 to 4 times more cautious than we were prior to July 1st when we go out, if we do go out and do those sorts of things. You know, I think the question about a tiered system or a county level system is kind of hypothetical when the whole map is red. And I think as case counts come down, we're going to consider every option. But again, this isn't sort of an on-off roller coaster. It's you know, this is something we're going to have to learn to live with, and we're going to have COVID with us probably for years. You know, at the end of the influenza pandemic, I say this every time, so I apologize for the repeat, but, you know, in 1920, people thought, well, thank God, you know, influenza's over, and we're still getting, you know, yearly vaccines now. So I'm hoping that you all will be patient with us. I think we're looking to find the most effective ways of doing things. We don't have major restrictions on the table or under discussion right now. I think in the end, the things that really will help New Mexico are more people being vaccinated, more people getting boosters. And by the way, we are really, we're really pushing, I think pretty effectively with the CDC and the federal government about the complexity of the booster guidelines. You know, if I had my say, I would want everyone in New Mexico to get a booster, you know, right away, as long as they're 18 or over and 2 months out from their J&J or 6 months out from their Pfizer and Moderna. So we're working it that way as well with our regulators and the CDC and the feds to see, is there a way to expand our vaccination efforts here in New Mexico with respect to boosters. So I mean, that's kind of a summary, but right now we don't have a secret list of things we plan to launch. And it isn't that we're unwilling to do them because we're tired. It's because when people get tired, we think that they're less likely to comply. One last thing, and that is there is one entity that is not fatigued at all with COVID and is in fact energized and accelerating its work, and that is the virus itself. And so it, because the virus is more infectious and spreading more rapidly, we don't really have the option to give up. We just have to find evidence-based ways of controlling spread, many of which we already know. And as you pointed out, and we've pointed out, we're just not doing. Thanks.
You.
All right, thank you, everybody. Next, we'll turn to Brittany Costello, followed by Morgan Lee, and then at that point, I'll have lowered everybody's hands, and then I'll just announce round 2, and everybody can raise their hands again. So Brittany, you are unmuted. Go ahead and ask your question.
Hi, Brittany Costello with KOB News 4. Quick question about the kids 5 to 11. I'm wondering if you can talk to me about so far the kids who have been vaccinated. I think it was around 1,300 with the first dose, on whether or not you think that is a good response to that age group opening up eligibility. And then I wanted to also ask about, on the dashboard, I saw that 35 to 11-year-olds were fully vaccinated. So I'm wondering, were they, if they were part of a study, or why, since that hasn't been an option for 3 weeks, if you could touch on that.
Yeah, actually, I'm not really quite sure about the kids who say that it's fully vaccinated. I can check on that and then get back to you. But in terms of the response, we had about 4% of the child population 5 to 11 respond to getting vaccinated that first week. And that's about that, at least the number of scheduled appointments, for the first week was about 4%. And it takes a little bit of time before the NIMSIS, which is the immunization system we use, takes several days before it appears that you become vaccinated. So I'm just using scheduled appointments as kind of a marker. So out of the scheduled appointments we'd had this week, it's about 4%, which is kind of similar to what we had with the 12 to 15-year-old response for getting vaccines. So we expect that this whole week that we're having this week, maybe the holiday might affect it, but we're expecting another 5% of kids to get vaccinated, for a total probably 10% to 15% of that population. So I think it is still it's still good. We do want to encourage more kids to get vaccinated because we still have a lot of appointments left available. I think out of, so far we have 9,553 kids with scheduled appointments in the coming weeks, and we still have 11,672 appointments available. So definitely, if you do have a kid, you can get them signed up, and then also, more and more sites are getting onboarded as they get their vaccine doses, especially pharmacies. Pharmacies were a little bit later to get started, so.
Yeah, and I would just add too that we patterned our whole rollout of the 5 to 11 vaccines after the 12 to 15 vaccines. And the 12 to 15 curve started out kind of flat for 4 or 5 days until everybody sort of got figured out what was going on, and then went up very sharply and leveled off. So there isn't much difference actually where we are now today compared to where we were with 12 to 15, except for that one supply, the delivery from the feds to the pharmacies that was a little delayed. So I think for sure we'll see it pick up. A lot of parents wanting to protect their kids.
And Brittany, I can actually answer your question about the group of kids who are fully vaccinated. Yes, some of them were part of trials. And then others, there appear to have been a few cases in which dates of birth were misentered. Not entirely sure if that was at the individual level or at the provider level, but our data quality folks are sorting that out now. So thanks for pointing that out. Next, we'll turn to Morgan Lee.
Hi, hoping you can hear me. Thanks for this opportunity. I just wondered if you could hone in a little bit on the northwest of the state and San Juan Regional Medical Center and explain what those crisis standards of care, what that translates into in terms of resources, additional medical staff, and perhaps procedures that are sidelined. I don't know if you can name some of the hospitals you mentioned that might be on the brink, whether that's Gallup or other places in the state. And just any telling details of what's going on there. And I did additionally want to ask about San Juan County vaccinations. Maybe this is too much of a deep dive, but the demographics there, whether I see somewhere on the website that white Anglo population may be a little lower in terms of vaccination rates. Thank you.
I'm going to just start real briefly because others have a lot to say about this. Morgan, you snuck in about 6 questions there. So I can't say who the other hospitals are who are considering. It's really up to them to make that announcement once they're done with their deliberations. So apologize for that. What crisis standards of care means in any hospital when it's declared, and this would of course apply to San Juan, is that they no longer have the resources they need to take care of the population that's presenting themselves for care. So we talked a little bit earlier about 70 some additional personnel that the states and the federal government is bringing into San Juan to try to help with their crisis, additional nurses and other technicians. I think there's some physicians in there too, between the federal DMAT team that's been sent out there and our staffing contract, another 70 people. Transfer rates from the Northwest, though, have been at all-time highs this past week. And so we always see that when someone gets saturated, that their rate of transfers from their ER to other hospitals, either in-state or out, goes way up. And we did see that actually late last week and this week as well from all the hospitals of the Northwest, but from San Juan Regional Medical Center in particular. As far as demographics of the vaccine, that's Laura's expertise. And it turns out that Christine was just in Farmington a week or two ago, and maybe the two of them can give us some perspective from those points of view. Thanks. Christine?
Yeah, I think that was just last week. Yes, I met with the team there at the hospital, and I would just say that they are amazing, and they are really, really tired, just really, really, really tired. I think, one of the main challenges that they were dealing with was it wasn't a bed availability issue. It was they couldn't staff the beds. So there's been real challenges with finding adequate staff. So the message that I have received is the surge staffing that the state was able to send out there along with the federal team. It's making a real difference. But I just want to say those folks are real amazing healthcare heroes, and they've been really at this for a long time. And they're very, very tired. And I know that they were having community meetings to talk to various community leaders to try to pull together and really get the message out that the hospital was really overwhelmed and struggling, and there was just a lot of concern for the residents there in the county that they were seeing such high numbers of people still coming into the hospital with COVID. And then, as David has alluded to before as well, it's now, there's a lot of delayed care from the pandemic. So you get this mix of seeing some really sick people for non-COVID related reasons together with a surge in the COVID specific patients. And it's just been overwhelming.
Thanks.
Laura, do you want to talk about demographics of vaccine? Because we do certainly have, as usual, more data than anyone can imagine.
Yeah, we do. Yeah, thanks to the amazing data teams we have across our Department of Health, including the Public Health Division and the Epidemiology Response Division. So here's our vaccine equity data on race and ethnicity and geography. And so that's done every week. And it looks at geographic vaccine disparity by race and ethnicity. So you can go to the website, which is the one that David always pulls up. So I'm just pulling up the vaccine reports here. And so if you go down to this set, you can see, for instance, let's just take San Juan for as example. So for American Indian populations, San Juan is vaccinated 22.6% above their population share at this week, in this week. So out of all the people who got vaccinated, what share of the population has more of the share out of 100%? So that's 22.6% for San Juan. For Black or African American populations, as a smaller population, it's negative 0.2%, so lower than their share. And then for Hispanic and Latino population, that's negative 9.9, negative. So that much percent less than their share of people who are there. And then for Asian Pacific Islanders, that's 0.4%. And this is all like per your population. And then here for white populations, it's negative 12.9%. So you can just see in terms of geographically per that region of San Juan, we have less people who are white population, race, ethnicity being vaccinated in that region. And I don't know how that's translating in terms of hospitalizations and deaths, but it could also, I don't know, perhaps Christine's team would be able to pull that out, but that's the data we share for vaccine. So we can know where to kind of address racial and ethnic disparities for vaccine.
Yeah, and just a reminder that if you go to the DOH homepage, there's that purple strip across the top. It says medical and scientific reports, hover there. I always tell you to go to the epidemiology reports, but the one right below that is a wonderful, very, very detailed report that Laura's team puts out every week with this vaccination data. And there are some reports under Epi for demographic and race and ethnicity information. I'm not sure they're broken down all the way to the county level. We have good data there as well. Thanks.
Great. So I think that completes our first round of questions. So everybody feel free to raise your hand again if you'd like to ask another one. I see two so far, and then I see, Morgan, I see you added a question in the chat also. So perhaps raise your hand and ask the question directly if you're able. So we'll start with Brittany Costello, followed by Julia Goldberg, followed by Dan Boyd here in our second round. Brittany, you are unmuted.
Hi, thanks again. I wanted to ask about boosters and the fact, obviously, that we're seeing more cases, as you guys mentioned, the waning immunity. I'm wondering, have you guys considered, or are you considering holding some of those like mass vaccination booster events? Just because I know that people have said they get the message and then they have to go in and schedule a time, and it's just maybe more complicated than easy. So I'm just wondering if you could talk a little bit about that.
Yeah, so we have some larger vaccine sites that we put out for boosters, but in the next few weeks, we'll actually be trying to pull some larger sites. One of the issues we've had is that I think we just signed a contract with Expo right now, but like one of the issues we've had is that things are still going on now, right? The conferences are still going on, there's activities. So before things opened up, we were able to use like Expo and the conference centers all around the state, and now those are being utilized. So we actually are looking, we have been working and finding new locations for those larger vaccination sites. So we're hoping by next week, we'll have several contracts signed so that there'll be more opportunities for boosters as well as larger sites for 5 to 11-year-olds. So that's, that'll be, hopefully we'll have more to report next week as we get these sites lined up. But we will be having more larger sites in the near future.
Also, just to follow up on one of Scott Weiland's comments in his question, we don't have a restriction on vaccine in terms of the supply that we have. So that's not a worry. We can get, if every New Mexican who wanted to be given a booster, we can get those vaccines. So that's not a rate limiting step anymore like it was 10 months ago.
Yeah, correct. We have plenty of doses. We just have fewer venues, but our pharmacists have been doing a super good job that they actually represent approximately, I think, 50 to 60% of all doses given. So they've just, shout out to the pharmacies. They've been really doing a lot of the vaccines. And then our public health department has been doing a lot as well. So hopefully we'll have more sites in the next few weeks.
Thanks, everybody. All right, next we'll turn to Julia Goldberg, followed by Dan Boyd. Julia, you are.
Oh, wait 1 second. I just also want to mention there are thousands of open appointments for booster doses too. There are over, I believe, over 30,000 slots available. So there's a lot of slots throughout the state. Yeah, just forgot to mention that as well.
No, thanks for adding that.
Mm-hmm.
Julia, you should be unmuted and ready to ask your question.
Thanks, Matt, and thanks again. I had a question about, I know that you talked a lot about Delta as being highly and more infectious, but is there any, do you think that you're seeing data that shows that it's also causing more severe illness for people who either are or not vaccinated? And I asked that because there were 2 data points. I sent them ahead of time, and I don't know why I'm trying to interpret things I don't understand, but the health and social report on page 3 shows a kind of decline in cases among those who have underlying conditions. And then the mortality rate shows on page 11 an increase of deaths of people who did not have underlying conditions. And I guess I wondered if that pointed towards any kind of change in the characteristic of how people are getting COVID or suffering from COVID, and if that was variant related.
Christine, you can comment too, but the CDC did put out a report a couple of weeks ago that conformed to our experience here in New Mexico, that in general, Delta did not carry with it a higher rate of severe disease. By rate, I mean your chances of ending up in the hospital or dying don't appear to be higher. On the other hand, if something is more infectious, then a lot more people get infected. So, but if, from a pure rate point of view, I think the CDC paper sort of showed, and of course our data was in that, contributed to that paper, that there didn't seem to be those kind of increases in hospitalizations. Like we talked about in the summer in Ontario and Scotland and places like that. Anything you want to add, Christine?
I should say, maybe I should have asked this more open-endedly, which is, what does this indicate, this change, the change in cases and deaths as it relates to people who do not have underlying conditions?
You know, the only thing, the only thing I would add is we have really high vaccine coverage for individuals 65 and older. And, you know, early on, you know, that population, especially 75 and older, individuals who were residing in long-term care, you know, we had really high rates of disease and hospitalization and death. And one fantastic thing we're seeing is that, you know, we have really high vaccine coverage in individuals 65 and over. And so we're not seeing those folks with we're not seeing increased rates as we had seen prior. In other words, when you look at cases in long-term care, they're just dramatically decreased compared to early on in the pandemic. And, you know, as we age, we acquire these underlying conditions. So individuals are much more likely to have multiple comorbidities as we get through as we age. I think there was a really low proportion of cases reported with comorbidities for November. I'm not sure if that's what you were looking at, but that's really incomplete. So I would expect that would change as we move through the month. And then otherwise, I would just, I think David answered the first part of that about the CDC data.
Is that what you were asking about, Julia, that downtick?
Yes, that's what I was looking at.
Okay, yeah,
Yeah.
a lot of those underlying conditions get backfilled as
And
well.
I'll just point out one other thing is that we know, I believe Laura mentioned this early on, school age children as a group don't have don't have these underlying conditions in high numbers as we see in elderly. And, early on, school age children made up about 10% of our cases. And now with Delta, and certainly also with the resumption of in-person school, school age children are making up about 23% of our cases. And then that's going to drive down that proportion with underlying conditions as well.
Got it. Thank you so much.
All right, great. Next, we'll turn to Dan Boyd. And I do notice that we don't have any other hands raised. So after Dan goes, I'll open the doors. And if anyone wants to do a third round, we can do that. And otherwise, we'll aim to wrap up at that point. Dan, you are unmuted.
Thanks again, and a lot of information to digest here today. I wanted to ask actually about a story that was in the Santa Fe New Mexican about a teacher in Santa Fe possibly exposing or infecting some unvaccinated students in the classroom. Some parents expressing frustration that they don't know the teacher's vaccine status. Obviously, teachers are required to either be vaccinated or undergo the weekly testing, but was wondering if you all maybe had any thoughts on that and just kind of as a general situation and maybe specifics as well. But
yeah, I'll start. So I'm trying to, I did not see the article, so apologize for that in advance. If you want to drop the link in the chat, one of us can scan it quickly. I'm not sure what the parents would do with the information about the teacher's vaccine status. It's, right now, I think schools are pushing really hard to get staff and staff, which includes teachers, vaccinated, still working on that across the state. But what would be that intervention that parents would make? And I guess the cases, to me, I understand like the special nature of schools and kids and teachers, but to me, there's a broader question about should everyone's vaccination status be public or private? We can't shut up here on this press conference about the fact that we've all gotten our vaccines, but we're doing that to just sort of, let people know that they're safe and effective. So I don't know, I have to think about that, but I think we've thought, as a doctor, maybe you're asking the wrong group of people. Maybe you should ask a press conference full of lawyers, because I think all your doctors are going to say, hey, someone's vaccine status, that's part of their medical record, their personal health history. That's confidential. I'd get fined $50,000 if I gave away confidential health information. So I think you're raising a really big, sort of question that goes beyond schools. And I don't know if I have much more to say or feel like comfortable. I'm not an ethicist, so comfortable diving any deeper than just that initial reaction. But Christine and Laura, if you have any other comments on that, that would be fine.
Yeah, I mean, I just kind of glanced over the article right now. And I guess, like David said, the concern is that if your teacher's unvaccinated, how are your kids protected? And I think that one of the things we can do that is within our power right now is to vaccinate our 5 to 11-year-old kids, encourage the mask wearing that they do in the schools, and, have as adults vaccinated to protect all of us. But it's hard to say to the school, right, you have to do this right now. That's not a mandate that has come from the federal government or anything. So I think that we just have to keep on encouraging people, teachers, to get the information. They might have hesitancies as well or questions. So as we can keep on answering people's questions and build their confidence for the vaccine. I don't know. Christine probably has more to say as well on this.
Oh, no, the only thing I was just going to say, that's a great question. I have school age children that definitely resonates with me. And I think, I can't really address it directly. I don't have anything new to add, but the only other thing I would mention is that, I hope to see the test and stay program roll out here in Santa Fe as well. And I don't know all the details of the story which you just relayed, but if children that had been exposed were able to test and stay in the classroom, that would have been a really nice option. And again, I'm sorry that doesn't address the specific question at hand, but I would like to put a plug in to say that this is it's an exciting program, and I'm really going to be following it closely as it rolls out, and hope to see it roll out very soon.
Okay,
Thank you. I appreciate it.
Looks like a couple more hands have gone up, so this would be a good moment if you're interested in asking a question and a third, and I think probably final round of questions here. Now, please do raise your hands. Otherwise, we'll treat those raised hands as the final questions for the day. So Scott Weiland, we will turn next to you, and then it looks like Julia would like to ask another question, and then we'll see where we are. Scott, you are unmuted. Feel free to ask your question.
Can you hear me?
Yes, sir.
Yeah, okay, I didn't get the unmute option this time. First I just want to throw in, I'm the person who wrote the article.
Oh.
So what I got from the parents, and I'm not going to pose this as a question just because I didn't seem like you quite touched on what the whole issue here. Mm-hmm. They thought that, yeah, they understand that, it's confidentiality, there's a right to confidentiality, but then they felt that it should be balanced with knowledge of parents being able, having that knowledge and deciding whether, they should send their children into a classroom with an unvaccinated teacher. So I don't know what kind of options would be available to parents to send them elsewhere, but they just felt that, that's something that they should be privy to. In this case, it's the fact that it is a virus that can be spread. So it's not like cancer, that's you can say that's a personal issue. This is something that can be transmitted, so it kind of puts it on a different level. So that was their argument. My question is considering that the transmission or the infection rate's pretty high in Doña Ana and Bernalillo County, any chance that there could be federal teams going there, or are there already going there?
Yeah, Brianna, could you bring up the that map slide that I showed with we've got contracted employees that the states arrange for the hospitals in both Doña Ana and Bernalillo, probably expanding Bernalillo even more. And Brianna, we can show that, but one point I neglected to mention is the state is able to act as an intermediary for these staffing augmentations throughout the state and have that reimbursed with federal dollars 100% through FEMA. And I'm told that FEMA extended that 100% payment for pandemic response for another 3 months. So that'll go through March of next year as well. I might be able to alternatively, if Brianna's having trouble sharing her screen. Oh, I have it right here. I should have just done it. Let me just show that map one more time because that kind of clarifies it. Of course, I have to get back to Zoom now to show the map. All right, here we go. Yeah, so you can see here the that they're going at various points during the state. We did an overall assessment of need about a month ago, asked all the hospitals to tell us how short they were, we tried to prioritize resources, but you can see, this is an older slide. So the San Juan number was actually in the 70s when we added the DMAT team, but you can see 59 here in Las Cruces, specifically to your question, 34 in Otero and other southern counties heavily represented in the staffing initiative the state is sponsoring here. I'm sorry, that was a slightly outdated slide.
Okay, Dr. Scrace, are you still looking for information or comfortable going on to the next
No,
question?
I'm good. I'm good moving on. I know the
Okay.
number was in the 70s, so that's okay.
Got it. Okie doke. Next, we'll turn to Julia Goldberg, followed by Brittany Costello. Julia, you are unmuted.
Thanks, Matt. I heard from quite a few people this week who were kind of wondering if they could get more of a drill down about what you're seeing in terms of activities in which people are engaging prior to contracting COVID. That health and social characteristics report used to include those reporting activities prior to illness. I don't think it has since the summer, and I don't know if it's still relevant, but I didn't know if you could offer any thoughts on if there are any trends that you're seeing in terms of, is it travel? Is it going to church? Is it gyms? That sort of thing. Thank you.
Well, I'll start with my very high level summary. Julia, my high level summary is that everybody who gets COVID is doing everything. And so Christine can give you a little bit more nuanced version of that. But remember when people would have like one contact or 1.2 contacts? I mean, a lot of people doing a lot of things to the point that it's weighing down our contact tracing effort because it takes so long to get a single case in with everything they've done. But Christine, any more detail?
Sure. So, when the Delta surge hit in the summer, we had to make some changes so we could increase the number of people that we were able to reach. And so we really streamlined our script, or in other words, the questions that we were asking. I don't think that asking those questions at this point in time are actionable. Really early on, it was useful data to get a sense as to where people, what were the activities that they were reporting that would be possible transmission events. A transmission event could have occurred there. But over time, the data became less actionable. And certainly when you have this number of cases and when you have a myriad of activity options, let's put it that way. And so what we find is there isn't any clear trend. There is travel inside the state, outside the state. There is attendance at events. There are gatherings in the home. There is church going. Anything pre-pandemic that we were doing as part of our daily lives, most folks are reporting. There's a minority of people who can say, I'm pretty sure this is where I got infected. And so let me say not a minority. There's a good number because they'll have some sense of where they think it occurred. And so where they think they may have been exposed. So we're sort of switching gears, and instead of collecting a long list of places, we want to start making that question less, we're not going to try to gather that data. We're going to ask the person directly, what do you think? Where do you think this most likely occurred? But I think the take-home message is it's very, very difficult oftentimes to pinpoint exactly where that infection was acquired because people tend to list many activities or events. And certainly now. That's the case.
Okay. One final question from, we do have a couple more questions coming in now. Brittany Costello, I believe you would have been next. You're unmuted.
Hi again, thank you. I just wanted to ask about the concerns about the Moderna vaccine, if you guys are aware of those, with some countries kind of discouraging the Moderna vaccine for people under 30 related to some of those heart concerns. I didn't know if you guys could comment on that.
Yeah, somebody said that to us in advance. So thanks very much, because I don't read the French newspapers anymore. And yeah, so we don't have access to the data. It's a French health authority, not exactly a governing body, but they make recommendations. And they're looking at data, and they advised people under 30 to avoid Moderna. Now, Christine is really familiar with our national data review body and the fact that they looked at the same data. So maybe I'll let her just comment on that.
So I think that there is an association between the messenger RNA vaccines and something called myocarditis or pericarditis. And there's this body of evidence was just recently reviewed by the ACIP, and then before that, the FDA. And so I can't comment specifically on what the French had decided to do, but I think what we wanted to do was push out information on this to say, hey, this has been identified. It occurs very rare, and I was going to try to pull up the actual data on that, on the number of reported cases per million doses of mRNA vaccine administered. There's specific numbers that I would share if I could find them. It's a relatively very rare event, and what the ACIP did was look at the body of evidence of what's the benefit of the mRNA vaccine versus the risk of this rare complication. And I think what else is important to know is that the cases that have been identified in the United States, the majority have been mild. They have resolved with rest, and I think the risk has been identified in a certain age group, primarily under 40, and I think the highest rates in males between a certain age range, I believe 18 to 25, somewhere around there. And but again, these are rare events, and what was determined is that the risk of acquiring COVID and the benefits of the vaccine far outweigh the risk of this rare complication, which generally is self-limiting. And so I'm not sure if I can answer directly what countries, European countries have elected to do, but here we are offering mRNA. We haven't limited it in the same way that you just mentioned.
And I just also put a link in there too to what the American Academy of Pediatrics and a lot of other academies of physicians and nurses and public health doctors have, supported the vaccine findings, that it's actually you can get myocarditis, but it's much more mild than actually getting COVID and getting myocarditis from COVID. And I think as a mom and also, as a mom and also as a family doctor that treat children, I think that, when you look at that data, you'd have a pause, and then you're like, well, actually it is worse that your kid get, myocarditis and than if you just got it from the vaccine. And so I both my boys got it and they fall in that age group.
Thanks, everybody. Jeffrey Plant has his hand raised. So Jeffrey, feel free to ask your question.
Thanks, Matt. I have a question similar to the question about the vaccination status of teachers, but in a different context. I recently heard from a vaccinated woman who fits in the 65 and older demographic, who went to the hospital for what she described as a minor surgery. And after being prepped by a nurse or a nursing assistant, she learned that that person was not vaccinated. The woman who had the surgery, she felt that this put her in danger, that it was a risk she hadn't signed on for. But she was told by the hospital that the hospital doesn't have any right to ask their staff to disclose their vaccination status, et cetera. And I just wanted to ask you all, as medical professionals with extensive knowledge of COVID-19, should unvaccinated nurses and other clinical staff be interacting with surgical patients?
Yeah, so that's a great question. And I'm going to assume that it happened relatively recently and not like before the public health order. I think it was around August 15th or thereabouts, requiring hospitals to report vaccination for all employees. So
that's right, yes.
Okay, so if that happened recently, somebody somewhere got some bad information. Hospitals have been reporting to us weekly and soon to be monthly for most of them since September. We know that I think it's about almost, these are going to be rounded numbers, but pretty accurate. 90% of hospital workers are vaccinated fully, 2% partially vaccinated, and about 7% have an exemption, and there's only 0.6% left who have no exemption at all or no vaccination. And they're in the process of being actually required to be dismissed from their roles. So not only do hospitals have a right to ask employees about their vaccination status, they have a responsibility to do it, and they have a responsibility to report that accurate information to the state. The state, as you probably know, is a regulator for licensing for hospitals and does periodic site visits, and we will be reviewing all that data on vaccination status for healthcare workers when we do those site visits on a periodic basis. And so I think there's just some confusion there. I think it's hard to, I think it's an interesting concept that someone would have had a different point of view about getting surgery if they known someone wasn't vaccinated. There could be some market pressure. It would be kind of cool if hospitals started advertising 100% of employees vaccinated or something like that. But according to the public health order, that unvaccinated person must be getting weekly testing, and only in the instance that they have an exemption, an approved medical or religious exemption. If they don't have a medical exemption, they don't have a religious exemption, and they're unvaccinated and working in patient care, that violates the public health order.
Okay, I don't see any additional hands raised, but I'll put out that last opportunity. Anyone might like to ask a last question today? Going once, going twice. Okay, with that, I think we'll turn it back over to our principals for final comments. I think we'll go in the order of Dr. Ross, Dr. Patajon, and Dr. Scrace.
Okay, thank you very much. I think I just want to add that I think living with COVID-19, and this is certainly from a epidemiologist perspective, but living with this virus means being aware of the level of disease activity around you, because you can then modulate your behavior in ways to protect yourself. So I think it's just really important to understand that right now we have really we have very concerning levels of case rate and a rising incidence around us. And so I would just implore everyone to consider all of those COVID safe practices, consider whether you want to avoid indoor activities in public, whether you can avoid crowded areas. I would also say, look at the type of mask you're wearing. I would use the best type of mask that you can. An ill-fitting mask that's not over your nose and your mouth is not really doing its job at all. And so that's important to consider. And then physical distancing, hand hygiene, and then anyone who's not vaccinated, I hope you'll consider going out and getting vaccinated. And then I just want to make one other comment. If you've had COVID-19, we do know that you have some natural level of immunity for a certain length of time. What we don't know is that, it varies by what sort of infection you had, or, was it a mild infection, moderate infection? And then it may vary based on your own immune system. So even if you've had COVID-19, that's why we recommend you go out and get a vaccine, because you'll increase your level of protection, and we believe it's the safest thing for you. So let me pause there and turn that over to Laura now.
Yeah, no, thanks, Christine. I echo everything you say, and just really saying thanks again to all of you for sharing the message. And really, it's up to us how this pandemic turns out. So, what can we all each do ourselves and together as a community? So thanks for all you're doing. Get your boosters, get your first vaccines, get your 5 to 11 vaccines, and thanks for all you're doing.
Yeah, and I would just close by thanking everybody for your attention, your time, listening in. Great questions again today. Cause us to drill down even further into our data, and we love to do that. I would say as well that on the boosters, you can go online and schedule an appointment. We have lots of appointments. More mass vax events to come soon, particularly if you're over 65 or meet one of those criteria like over 18 with an underlying condition, which basically is those two groups, and then people working in high-risk occupations where they interact with the public. I mean, we're over 70% of New Mexicans already eligible for the booster, and this team on the call today and others are working with the feds to see if we can't get that expanded even further. So get the booster and be careful, and just ask yourself again this question: am I being 2 to 4 times as careful this year, given that the virus is 2 to 4 times infectious as I was last year at this time when we were in a very similar situation? I think most of us would be hard pressed to answer that question with a resounding yes. And if you're one of those people who can, then we thank you and we bless you, and we ask you to tell your friends to do the same thing. And if you're one of the people who answers no, then maybe sit down at dinner tonight, talk with your family and friends, like, what could we all be doing to be more careful, to protect ourselves, our family, and our community? And in particular this week, of all weeks, our hospital workers, many who are sitting around tables right now trying to decide whether their hospitals as well will go into a crisis standards of care mode. Thank you very much.
Thanks, Dr. Skouras, and to all our panelists and to our journalists for joining us today. And we will be back very soon for yet another regularly scheduled COVID-19 update. Thanks so much, everybody. Have a great afternoon.